Good afternoon, good evening, everyone, wherever you're joining us from today. We want to welcome you to the Nurse Policy Entrepreneur Café. We believe that nurses are well positioned to incorporate health in all policies because we're the first witnesses to all of the determinants of health, and we keenly understand that health system strengthening expands beyond traditional direct care roles. Nurses work in multiple spheres of influence to shape health and social policy that addresses problems in healthcare, including the workspace, in government, associations, and in civil society at large. The origin of the word entrepreneur comes from the French language that denotes a person who undertakes a project. So this doesn't necessarily mean business entrepreneurship. This concept is not unfamiliar to nursing professionals, and societal changes have been initiated by individuals who have observed a problem and figured out how to disrupt the status quo and the equilibrium to improve something. And policy does not always mean politics, and deriving effective change does not always mean running for office to do so. A policy is just a set of ideas or a plan of what to do in a particular situation. The Future of Nursing report has a multidisciplinary call to action for nurses to assume leadership positions and serve as full partners in healthcare reform, from practice to policy, including in decision-making for national policy. And nurses must prepare to engage regardless of our practice settings. Nurses, as the largest constituent profession, have maintained our status as the most trusted profession for decades, yet we're rarely engaged in the process of healthcare policymaking. The concept of nurse policy entrepreneurs, while it's been practiced for centuries, is often overlooked, and this gap is not only from our invitation, but also our struggle to identify as thought leaders in this arena. So, becoming engaged as a thought leader and policy influencer is an element of our professional identity, with the beauty of diversity in our individual perspectives, personalities, and leadership roles. If we leave it to other disciplines to determine healthcare policy, whether they are healthcare providers or not, reform will be marginalized. We must become known as more than just the trusted profession, but also as the most influential when it comes to policy, because we have the highest touch points in healthcare. So, how do we address these issues? As the complexity of policy increases, a higher degree of expertise and skill sets become more important. It becomes harder for individuals to influence policy. But if we foster dialogue, inclusivity, innovative thinking, we can better understand how to engage. Our methods here at the NPE Café are based on theory to address the gaps between ideation and action. We promote diverse insights for meaningful evolution. We use Parse's human becoming community model to describe how the concepts of co-creation lead to community building and evolution. And the World Café method is the gold standard that establishes a psychologically safe environment for collaborative innovation and shared learning. There are three change concepts that might seem paradoxical at first, but they really complement discussions and shared learning. This includes moving and initiating. Think of how we shift between somewhat chaotic discarding and creating of new ideas and meaning as a result of these conversations with others. And then we have anchoring and shifting. So recognizing that when an idea improves your previous thoughts and shifting them after this contemplation, or anchoring further down in your previous thoughts and making them stronger as a result. And another one is pondering and shaping, so dialoguing and then meaningfully listening to complete thoughts of others. This is the basis of our cafe that we host once monthly. We have no affiliations, no paid membership, no eligibility criteria that prevents getting engaged, no barriers, and no borders, because nurses need an organized process to meet, network, and discuss approaching these issues, not debating our stances on them. In holding this space, we create structural empowerment for nurses to become effective policy makers and implementers, while simultaneously exploring how to create a system for true deep democracy at all levels to improve our communities. It breaks down imposter syndrome because by facilitating this evolution and guiding nurses through group mentorship to resources and inviting them to be active, you embody what you believe to advocate in new ways. We are open to all nurses and students at all levels and in all settings across the world. Now you can start with your own preparation. You can clarify your why, your reason, your purpose, how you got into nursing in the first place, and continue to develop an expertise beyond your clinical expertise within hospital walls. Create a personal professional development plan. Find organizations that share your why, share your values, and join them, and be able to engage with them, developing your social and political network. And by just practicing reading, writing, and speaking as much as possible about this to develop your expertise and become that subject matter expert. Then you can take a deep dive into our skill sets. We've organized a living and evolving list of essential skill sets that one might need to develop all or part of their professional expertise and their identity as an NPE across the career continuum, which can change. Your needs can change as you grow. And you might organize these a little bit differently, or you might share something that you think we're missing in them. And now we do have some netiquette that we follow. It's very simple because we believe in open access to these resources. We do record these sessions so that our community members across the globe who cannot always join synchronously each month can access this information. When we have a speaker, we get their consent to share this and have first rights to edits before we have our Zoom session. To maintain our psychologically safe space, we do not share the discussion that follows. There might be occasionally really robust Q&A afterwards that really adds to the month session and the discussion and conversation, but we carefully either edit this and include it without sharing the community member's name or face or voice, or if that's not possible, we ask for consent to do so before posting it on our website or YouTube. If you want to completely make sure that you avoid any type of this inclusion, feel free. Leave your camera off, stay on mute, and you can engage with us in the chat, which we never share. So here's some of the resources that we regularly share our material on. The online process includes a one-on-one navigation, guidance for newcomers to our cafe and community. We onboard them to theoretical foundations, as well as the resources that we've developed so far, and the process for our monthly cafes. We have resources that are collectively aggregated in a multimodal repository for adult learning and various styles of learning. We have a modest website. It does serve as our centralized source for these efforts. These resources are infographics, we have roadmaps, educational content, links to springboard you to other resources that already exist out there that we don't need to recreate. We just kind of curate them for you. And our monthly Zoom Cafe sessions have evolved to highlight a speaker organized with this skill set so that we focus on every component of them as much as possible in a know one, see one, do one modeling. And we share this experience from nurses to nurses, and we share our dialogue about it. The implications are just that, at the very least, you as a nurse policy entrepreneur walk away from each cafe with a little bit more understanding about steps you can take to make an impact. We seek to empower nurses as influential advocates and full partners in healthcare reform, translating advocacy to policy. After dialoguing in our open door, judgment-free space, using our resources, and diving deeper into your why, we as nurses can build upon our practice of advocacy out in the world and in broader engagement. So let's get started. And I see that we have this here. I know we have friends across the career span. We have 5 generations of nurses working in their workforce today. And I do know that we have some good friends returning from around the world. So this is really going to be a wonderful, robust conversation. Today is the middle of the 2 weeks of the United Nations High-Level Political Forum. As Art was just talking about in our brief conversation, I was getting things figured out on the back end for this Zoom. And so we are going to talk about what the heck is the High-Level Political Forum? Why does that matter? What's being said at the United Nations with these member states and ambassadors and all of these terms that we have to learn, and how can individual nurses like myself, yourselves, everyone in this room, join the conversation, learn about what's going on, connected to our practice, connected to our local place of work or volunteerism, and also talk about other UN things that happen throughout the year, ways that you can get involved, and also some other international conferences where we can share this amazing work and insights with other nurses and connect with them. Let me just quickly introduce here everyone who is going to be contributing to this conversation, the presentation. I myself am Grace Kistner.
I've also got my colleague Arik Shimmick. I have
Yoon.
Danielle Brochu, Megan Allen, Anjali Conflenti, and Regina. I will let all of ourselves introduce ourselves as we come onto camera and speak to share how we are coming into this room. But we are going to be talking about scaling nursing leadership for SDG impact through partnerships for health in all policies. Arik, I'm going to go ahead and pass it to you to get us started.
Sure, yeah. So
Great.
thank you for that introduction, Grace. I'm Arik Shimmick in Chicago, Illinois, pediatric clinician, former. I've done a few different things related to advocacy, but I'm always very interested in helping people find their way. So that's why this conversation today to me was particularly timely and of interest because I feel like at the end of the day, there's a few of us in the world that walk the walk and use the terms and may not fully understand some of the interconnectedness of the work that we're doing. So in the model of the cafe, we want to have this space to ask each other questions, share experience, think about things in a different perspective. So I'm going to go through some slides here in the beginning, and I just will warn you that it can be a little bit content heavy. Certainly, I'm a person who I like having something to refer back to. So if you want these slides as a way, or maybe as a resource or a toolkit, a lot of you who have done the Sigma Advocacy Academy will recognize some of the content that we use to just kind of level set with what some of these names are, what some of these events are, because that's when we start to talk about how you chip into your first pathway or into your first event. So that's my information there at the on the screen. But if we can go to the next slide, I think we're starting with just some kind of, why are we talking about this, right? And these are really coming from a kind of social determinants of health perspective. In this particular event, yes, we are going to share insights and expertise about the UN, but we need to remember kind of why we're doing this. And so when we think about what brings us to nursing, what brings us to these conversations on a Saturday in July, it resonated with some part of you or your experience. And for our patients, these are some of the things that they're facing, right? A lot of our patients don't necessarily get to choose when they need healthcare or who they need it from, but the fact remains that we all need it at some point. So how do we as nurses and clinicians and nurse allies pull our knowledge and experience up into something large and awkward and cumbersome like the United Nations? So that's kind of where I'm going to start us today. Please do use the chat feature, interrupt me. I will breeze over some of the slides because, again, feel free to read them, but I want to just give everyone a basic level set here. So when we can move ahead to the next one here. So really, like Grace mentioned, this is the high-level political forum that happens every July in New York. Of the three kind of pillars of the United Nations, right? Those are peace and security, human rights, and sustainable development. That third pillar, this is the highest event of that pillar every year. Happens in New York, and it's a chance for the entire UN system to come together and say, how are we doing on these SDGs that we told each other we would work on? And, they come due in 2030, which is only 4 years away. And you can imagine quite a few things are off base. We're not going to make a lot of these targets. So the conversation has shifted now into how do we continue to make progress? Who has not been a part of the conversation? And what is it going to take to kind of get us set up for what comes after the SDGs? So when we first transitioned from the Millennium Development Goals to the Sustainable Development Goals, there was, I think, about a 3-year period. So that period of like planning and development and collaboration. So kind of what that means is starting in 2027, I would expect there's an opportunity for us as nurses to be able to weigh in on what do these SDGs look like going ahead and how do we get involved in the HLPF every July. We'll go ahead to the next slide. We talk a lot about different events, and again, we want to help you recognize some of the differences that you're going to hear in the terms and the acronyms. So on the left, we have a brief overview of some of the major events that happen throughout the calendar year. These are pretty routine. right? CSW, the Commission on the Status of Women, is every March in New York. The World Health Assembly, where the WHO comes together to kind of do its legislative stuff, all the voting, all the elections, all that piece happens in Geneva every May. Then over the summer, we do some fun stuff related to like digital technology, AI, all these kind of newer topics. The HLPF in July. I know, I love that in there in August it says everyone take a break. I wish nurses took more breaks, if I'm honest. We seem to be working year round, but this leads us into September with the UN General Assembly and the Global Goals Week. We always do mention the World Health Summit in Berlin in October, not because it's a UN specific event, but it is very well attended by most of the entities, and it's a great place to network. It's a great thing that's open to the general public. You do not have to be invited. You do not have to be in any way connected to any of this work. I went for the first time as an interested individual. So love to always give that a call out. Our climate friends, COP happens every November. And kind of throughout the whole year, you're going to hear about different side events versus parallel events. So a side event is usually organized by either a permanent mission to the UN or a UN entity like UNICEF, where parallel events are usually put on by civil society, and they kind of happen around the periphery of another larger gathering. So when we talk about HLPF right now, really what we're referring to are these parallel events that we in civil society are putting on to help advocate for marginalized populations, talk about the work that we're doing. But there's so much that happens throughout the year. The bottom four quadrants we included just to kind of help you think through, how do I pick the right event, right? What's my focus? Who am I trying to meet or target? What's my aim? Am I trying to learn something? Am I trying to make a connection? What's my direction? Do I want to elevate the work of nursing up to the UN level, or do I want to help translate the SDGs down to the local level? Having a clear idea of where you fit in these boxes will help you pick the right event and meet the right people. Next, please. Because I love graphics and color, it always makes a webinar look nicer. I threw a couple things in that are happening coming up. So if you're looking for a way to get involved in the next month or two, definitely check out. The first one in the top left happened 2 days ago. That was a 3-hour session for it's called Science Day 2026, but it is recorded. And as we talk through a lot of events, always know that things that happen in HQ are recorded and broadcast on the web TV, and they will have that file available. So even though it's past, feel free to check it out if you're interested. The other three are things that are coming up. They're parallel events that kind of wrap around or run in parallel to the UN General Assembly in New York in September. Next slide. So many of you, again, if you have been through the academy, have seen a touch or a version of this, but I wanted to just help people understand how some of these names are connected. And I have to admit, I was well into my role as a UN liaison before I understood some of these differences. So in the Café mentality, I wanted to be honest and open and say, I didn't really know the difference between DGC and DESA or some of this. So let's just talk very quickly as you see these groups of people so that you kind of understand how they relate to each other. So staying on this slide for a second, I want to talk through them quickly. ECOSOC is one of the 6 main principal organs of the United Nations. Okay. It is its own entity with all of its own staff and everything. It's one of the big 6 bodies. It's where about 70% of the work happens. So it's a really good area to focus. One of the other organs, or one of the other big, large bodies of the UN, is called the Secretariat, and that's where DESA comes in. So the Secretariat is kind of the workhorse of the whole UN family, right? That's all the administration, all the funding, the finance, that's where the Secretary General works. All of those things are kind of there to support the work of the entire system. So those 2 things at the top there are 2 big bodies within the main 6 organs. DESA is a piece of the Secretariat that helps coordinate the work that you're going to get involved in. So What does that mean? Well, it means it's confusing, right? Because there's a lot of people doing work and they all have to work with each other. And we spend a lot of time making sure that everybody's on the same page. We all have the same report. But know that within the kind of operations center of the United Nations, there's DESA, who is going to help the work happen. There's ECOSOC, who's actually doing the work. And then there's the Department of Global Communications, which is sharing the news about the work. Outside of that, you've got major groups and other stakeholders, which are independent groups of people that come together based on theme. We have co-NGO, which is another network of NGOs working kind of in parallel or wrapped around the UN system. And then the CSW Forum, which is a specific NGO-led arm that works really on CSW in March. So let's try to make that make a little bit more sense. If we go to the next slide, ECOSOC is, like I said, where all this work happens. You can become associated or accredited by ECOSOC. So as an NGO, like Sigma, for example, has special consultative status with this arm of the United Nations. Now, within that arm live certain things like the World Health Organization, UNICEF, other health-related groups. But the benefit of having that level of relationship is you get to do more stuff. You get to go to more meetings, you get to have more access to people, and you're going to be at basically the highest level of relationship that we as civil society can have. This does take a little bit of time to actually get that accreditation. It's a very lengthy process, and that process unfortunately has slowed down now that there's been some budget cuts and some workforce reduction at the UN level. But just know that if you have ECOSOC accreditation, that's kind of the gold standard or the pinnacle of a civil society relationship. If we go to the next slide, I think this is DESA again. Yes, so this is really the bridge between civil society and like the work in the economic and social space, but not necessarily led by ECOSOC who's doing the work. And that's why I think this is so confusing, because DESA is kind of the people that help ECOSOC get their work done. They figure out how to pay the bills. They figure out what staff they need. They figure out how to put on things like the high-level political forum, right? So you could view them as supportive of each other, but they are very much a collaboration. You get to be a part of DESA through your relationship with ECOSOC. That's in comparison to what comes next. If we go to the next slide, the Department of Global Communications is something that you can affiliate with. That's a little bit of an easier process. Also requires you to be the representative of an organization, right? So a lot of these conversations I'm going to start here with today are about how do you, as the leader of a group of people, get connected. DGC historically has been a little bit of a faster, easier process, but I think that has leveled out now when you compare ECOSOC accreditation and the DGC affiliation. But really what on the right-hand side there, I wanted to just kind of call out that like being affiliated with the Department of Global Communications helps you be in the loop about the communication, the education, the outreach. If you want a higher level of infiltration, ECOSOC consultative status is how you do that. You can actually participate in the processes of lawmaking, of weighing in with official opinions. There's some like, perfect Venn diagram where we kind of overlap things. You can do some of that with DGC, but I wanted to just call out that as you start looking to get involved in the UN system, just know that there are different levels of affiliation and accreditation based on what you're hoping to get from that relationship. I will pause there just very quickly in case Grace or Regina or anyone wants to add in from their experience.
Yeah, I was just typing in the chat actually instead of jumping in here because you're not quite yet to describing co-NGO. But the way I kind of think about this is ECOSOC gets you in the room. DGC gets you talking about the room. You can share communications inside and outside. So inside the UN, outside to civil society. And upcoming still, we'll talk a little bit more about co-NGO, can often be referred to as Congo, but we want to differentiate that from the countries that use that word. the conference of NGOs, is how you can join other NGOs, other civil society groups that are really the ones doing the action on the ground, just like us nurses on the front lines. But anyone else want to share anything? Go ahead.
I'll also say too that the first time someone explained to me what the International Council of Nurses is, it made a lot more sense in my head. So I think about, if you want to go to the co-NGO slide, ICN is a federation of national nursing associations, right? So that means that it's all the nursing associations come together to form their own group. And that's kind of how I view co-NGO, right? It's all these independent groups that come together to streamline efforts, to support each other, to make sure that the civil society voice on topics like health is aligned and not in conflict with each other. Now, that's to say, right, we are all human beings and all of our NGOs and organizations represent their own thing. There's going to be conflict in these discussions about health. But it's important to know who Congo is, or co-NGO, because it doesn't exist as a UN entity. It is one of the civil society mechanisms that lives and surrounds the entire UN ecosystem. Why that's important is sometimes I feel like as a nurse, I felt really pigeonholed into only events that talked about health, or only to work with agencies and entities that relate to health. We need to be at everything from the meteorological organization to the labor organization. Like, we should be in all of these conversations. And that's where I think focusing your access points in the kind of civil society space allows you to have a lot more variety than if you were to just say, get a job with WHO. That's going to be a little bit more restrictive in the breadth of variety. So what you can do with co-NGO is, again, you are either a representative or a member of an organization that has a relationship with this group. You can have a full membership or an associate membership. Every time I mention this, I like to call out that the University of Minnesota School of Nursing became the first associate membership as for a nursing school. So this is something that is available as well if you're in the academic world. But I'm going to pause there and see if my analogy about ICN and co-NGO made sense, because it is a group of people that come together to make their own group.
Completely agree. I love that analogy. And I just want to quickly add in here the differentiation between full and associate membership with co-NGO. So we just talked about how difficult and long it can be to get accredited through the ECOSOC, the Economic and Social Council. That is the main pathway that co-NGO had membership. It's as old as the UN. It is 78 years old. Okay. And that's why it's kind of had some lack of differentiation with Congo, because there were not formal countries that had that name yet at the time. That's a silly thing to argue for. So we're going to call it co-NGO, because also that's the whole point, right? It's a conference. We're coming together. We're collaborating as NGOs and civil society around the world. So it really is a belonging space. But to not yet have, as an organization, not an individual, that internal access to really have that higher level influence, the unified voice of co-NGO is where the power stands, which is exactly where the unified voice of the ICN stands. You don't see the American Nurses Association or the Kenya Nurses Association, et cetera, advocating with the WHO. You see ICN advocating with the WHO and attending the World Health Assembly. Okay, so that unified voice is really where we come together and strengthen the advocacy when we don't have the official security access in the room. However, there are other organizations that haven't been talked about yet, and maybe are too niche and specific to get into today, but you can look into if it really aligns with your subject matter expertise or your hot button topic. Associate member status can come with other accreditations with UN related entities. Again, not actual UN entities, But I forget the specific term. ARC is on that huge map of all of the UN ecosystem, but it's all the way on the right-hand side. There are organizations that we make assumptions are part of the UN, and they're directly affiliated and exist to work with the UN, but are not actual UN agencies. And this comes together from like the WHO, for example, is one of those. The UNFCCC, which focuses on climate and from our perspective, climate and health, and the Climate Conference of Parties every November. There are actual affiliations and accreditations, even just as an observer status, that you can have as an NGO to get into these rooms, even if you are not individually participating. And that does allow you access to the organization. That's the parallel arm that we're talking about, co-NGO right now. But I'm also hoping to hear anybody else's additions, thoughts, or Arik, your first question posed was, does the ICN analogy make sense?
I'll just say too that I think for this, because I've been doing this work now for a while, and I think the number one question that I get is how do I get started or how do I get involved? How do I get in the room? It can be very difficult, right? It's for the most part, the UN system is meant to not be an individual sport, right? You're supposed to be there on behalf of a nation or on behalf of a something. Now, we all participate through other organizations, NGOs or professional associations, but this is like such a great place to get started because not only are you going to find like-minded people, but as Grace mentioned, you might be able to get something that's easier, quicker, and faster than full ECOSOC consultative status, which apparently now is like a 5+ year process, right? Maybe you don't need all of that access. Maybe you're looking to get your foot wet or to meet some people. And that's where something like this is perfect. That, the substantive committees that they have are, again, thematic. They're focused on something that, you might find one that aligns with your work or your interest. But we always like to talk about this because it is the power of the numbers and the relationships that people have.
We skipped over the major groups. Do you want to kind of quickly talk about that and how
Sure.
that kind of ties in as well?
Yes. So major groups is similar in some ways to co-NGO, where it is a collection of people who have come together, but their work is specific to the high-level political forum. So they work throughout the full, 12 months that lead up to July, but there's about 21 different groups of people that represent a wide variety of topics and special interest groups. They are recognized by the United Nations, so it's a little bit, again, similar to co-NGO where they've been around, they're recognized, they're respected. They, again, are a little bit, I feel like major groups is a little bit trickier to get into and to find somebody who's like active in, because a lot of their a lot of their major groups are minor. But overall, this is a name that I kept hearing when I first started doing UN work. And I was kind of laughing because I was like, I don't really know the difference here, and I should probably do some research. But it's another civil society group of people, but this one is specifically focused on topics related to sustainable development and helping the HLPF happen every summer. Last but not least, because we always love, I honestly think Commission on the Status of Women every March is one of my favorite events, if not the favorite, because it is tens of thousands of people from around the world come together to talk specifically about SDG number 5, which is gender equity. They put on a massive amount of official events and business happen during that time. What this group does is it creates that parallel pathway for us in civil society to come through and say, we hear you, we like what you're doing. However, you need to hear from us as well. 750 plus events happen every year in the periphery around the United Nations compound in New York. Since 2020, they've done an incredible job of transitioning, I'd say a significant portion of this to be a virtual offering. But the idea, again, here is that you are going to meet like-minded people from civil society who are actively trying to elevate their work up to the UN and translate down the work of the SDGs. So NGO CSW Forum is really what we're talking about when we here in this group are talking about CSW. It is it's actually a substantive committee that belongs in co-NGO. So hopefully you're starting to see how some of these are connected, like co-NGOs, that group of NGOs that come together to make the world a better place. NGO CSW is one of those people that's specifically focused on the parallel programs in March. All of these programs, unfortunately, have their own registration platforms. Most of them are open to the public. It can be a little hectic trying to figure out what you want to go to and did I get in? Did I get a seat? But we put the link there for you as well. So I think that's where I'm going to stop with kind of knowing some of the names. Again, reach out if you have specific questions or if you're trying to help better understand some of the relationships. But the idea is there's a lot of civil society at the United Nations, more than I ever thought there would be. And these are some of the people that you can start with if you're looking.
I'm just going to quickly share. I personally think this is one of the easiest ways to get your entree into the United Nations ecosystem. You can do it as an individual. You can do it from all around the world. It is the longest, meaning it's 2 weeks long. It's not just a one and done chance. And I think probably any of us who've engaged in this room with the United Nations has attended a CSW event. Like that's definitely one of the first ways to get in. And also just like learn what it's like to engage. If you have the privilege and the ability to go to New York, where this is currently still hosted, that might be changing. A lot of things are changing at the UN. And to be in the literal environment, not necessarily of the UN headquarters itself, but the surrounding environment, what we call the broader ecosystem. There are buildings surrounding the headquarters that are considered part of the UN grounds unofficially. And running across, back and forth between these buildings across Midtown and Manhattan and going to these different delegations' houses. They call the delegation or the embassy's houses sometimes, like Nigeria House, for example, is how it's considered. Or the other semi-official, some of the buildings are considered official and have security during higher level events when we do have member state heads at HQ. That physical environment, whether you're on headquarters grounds or not, that really gives you an entree and understanding of who's showing up. Where are things held? How is the process? Do I need a special ticket to get in, or can I just register? Do I even have to register? Is it first come, first serve? And the thing is, the UN is messy. This is not as clear cut and straightforward as the paths that we have in nursing. If I want to become a med-surg nurse, I have a very clear path. If I want to become an ICU nurse, I have a very clear path. And in the hospital, we have a clear ladder, our chain of command, right? You've got your nursing assistants, you've got bedside nurses, you've got management, you've got CEOs of hospitals. It's not so clear cut when you want to get into advocacy, period, but you would think that the UN is very formal and that would come with some structure. And there is structure, but it's still so messy. And so I think this is a perfect example to how one can get integrated without really even knowing any background. This is a wonderful entree. But I want to open it up to not only our panelists, but others in the room who have attended CSW events, especially if that was your first entree, and just share your experience real quick.
Yeah, Grace, I would agree with you. I went to CSW for the first time 2 years ago with Angelique, one of my co-presenters. It was truly eye-opening to see the grounds, see how everything kind of works. To your point, attending the events at the other buildings around the campus, the UN really is huge when you consider just the scale of the surrounding unofficial buildings as well, and kind of darting from meeting to meeting. But that environment really is an excellent step that individuals can take to get in. I highly, highly recommend it as well. Grace, right on the money.
Yeah, I also meant to attend one of the CSW forums, albeit online. I did a presentation from Kenya, and I think the experience was amazing. Although it was online, I followed all the sessions from the UN TV. And yeah, it was an amazing experience.
Eric, do you want to jump into the Sigma Academy? I think this is also a really easy and light lift that has open access. There is a fee for it, but I think, again, it's open to nurses around the world. You don't have to be a member to access this course, and was another first entree to learn about this space for a lot of us.
Yeah, definitely. If you could advance the slide. I think I just have three quick slides on this to just call out. Really, I think where a lot of us met for the first time was as a part of this academy. But Sigma does put on twice a year the Global Advocacy Virtual Mini Academy, which is 6 weeks in length and is 100% online. The website that is there at the bottom of the screen, but it's really a great chance to, again, learn more about how somebody with ECOSOC consultative status uses this relationship to influence global health policy, better understand some of the skills that I think nurses have inherently, right? We're very good at some of the things that make for good diplomacy. Seeing both sides, changing your message based on who you're talking to, understanding how to resolve conflict. I mean, all of these are kind of covered in this session, but also I think important as you think about who do you want to be and what do you want to get from your relationship with the UN. If you go to the next slide, I think that is just some numbers. It is truly global. I think now there's been 7 cohorts, over 300 graduates, and I think about 25 different countries represented. And then on the last slide, we just have some quick facts that people really felt it was a good use of their time. They felt that they were better prepared and informed about the SDGs. So since I see a lot of familiar faces on this call today from that program, I won't dig into it, but it made sense to kind of end my piece of this presentation by saying, as you better understand the how, both in the structure of the UN, we also need to understand the how in our own personal skills and the development of kind of our toolkit. So this is something I will always be proud of to be involved in and to promote, because I think it's just like what we're doing here today, sharing ideas, asking for help, asking for clarification. So I hope you check it out.
Wonderful. And I love the conversation that's already starting here. Regina, I see you as bridging so much of this conversation already, because you are an earlier career nurse. I don't want to say early, because I think you're starting to approach mid-career, especially with your experience, not by age. The age with the UN, youth means something different than children and teenagers. But I think that you bridge so much of this really well because of your past experience on the ground, literally around the world. And also coming into Sigma in a formal position and having those experiences. So kind of adding to the conversation, as Sigma being one of the organizations that a lot of us are familiar with and participate in, could you please share your experiences as your current position right now?
Absolutely. Hi, everybody. Thank you so much for having me. My name is Regina Yun. I'm coming from Canada, and I'm currently a Sigma Theta Tau International Honor Society, very long name, I always say, or Sigma Nursing's Youth Representative to the United Nations. And so I know in the poster they had also described me as a humanitarian. I previously worked for Doctors Without Borders in South Sudan, and have worked in a number of major cities in North America and also in the Canadian subarctic. And so, bridging all of this together, I was very grateful to have had these experiences now working from the bedside to the policy side. So, I'm hoping to kind of align this pathway so that everybody can also be engaged at this level, because, like Arik and Grace had said, it is very confusing. And even now, 2 years and a half in, it is still very confusing. So, I had worked as a nursing activity manager with Doctors Without Borders. A lot of people would say Médecins Sans Frontières or MSF. And so, these are places that have suffered natural disasters or conflict. But I always say that when you're working with health equity in mind, it doesn't matter where you work. And so my experiences has brought me from an emergency room in major cities, including Detroit, Michigan, and now to remote areas in the Northwest Territories, so 200 kilometers away from the Arctic Circle, working with Indigenous populations. And so everywhere I worked, I saw how the social and commercial determinants of health have shaped the health of populations, and especially vulnerable populations. Like Arik said, health is intersectional. We are in a very privileged position as nurses to be able to witness, to see patients and populations in all walks of life, where they're at. And therefore, our advocacy is to use our lived experiences and to bear witness to these things that are happening and elevate them through our advocacy so that we could record these injustices and inequities and advance to greater impact. I will say, I also wanted to highlight what we were good at as nurses, because we are able to interact with people from all age groups, from different areas, from all walks of life. We're working also at being in an interdisciplinary team. We're great collaborators. We're able to find complex terms and be able to speak in layman's terms and for different audiences. Beyond that, we also work as bedside nurses. We also advocate for patients every single day. It is part of our job as advocates. And so if we can do that at the bedside, we can do that at the United Nations. I will say a lot of the confusion is also about learning the language around public health and global health. I was able to learn a lot of the acronyms through my studies, but I will say that we love acronyms even in the medical world, but especially so in public health and global health. And so there were a lot of research involved. Now, I feel like websites within the UN are also all very confusing, and I thank you, Arik and Grace, so much for laying the land, the lay of the land for us. And I will say that even within these websites, they're going to have drafts and drafts and drafts of documents about what's going on in each conferences. And you're reading these 40-page documents saying, oh, what the heck is going on? What are resolutions? What country is doing what? And how do we, what are they passing? And how does that impact us? And so I will say getting involved in civil society was so important, because there's a lot of advocacy groups related to health or related to different sectors that outline what is happening and is able to break it down for us. And so just beyond the UN websites, like Grace and Arik said, please follow up with a lot of these civil society websites that really highlight what countries are doing and to keep them accountable, because it's our role as civil society to keep them accountable. I will always say that advocacy is about partnership and momentum. And so, of course, within each conference, they have several SDGs that they're highlighting for that year. And you may say that, well, it's SDG 6 and SDG 13 this year. That's not really relevant to health. I'm a nurse. I work in a hospital. I work in a clinic. I work in the Ministry of Health. I don't really see how water pertains to us, for example. But it is so relevant. Health is intersectional. And so within the UN Water Day, for example, we had prepared a statement just to say, not only is water so crucial to us related to vector and waterborne diseases, it also is relevant to gender equality, because the water collection done by women and girls in countries around the world. And so you always find out where your allies are as well within advocacy. With SONCL, with ICN, we had done an event back in March with CSW about gender equality and workplace violence. And so we're able to translate what our lived experiences and real life impact of what we do and what we see every single day to elevate it at the next level, and to find allies and to find other people within the civil society that was so interested in getting involved, because they didn't even know that this was an issue that existed. Lastly, I'll talk a little bit about speaking at the UN. I've been very fortunate to have the position of the youth representative, and like Arik said, within the ECOSOC system, you're able to get involved through submitting oral statements and written statements at the UN. And so again, some of these events may be very specific to a sector, may be very specific to a sustainable development goal, and you find your pathway as a nurse as to how that is relevant to you or the patient population that you are representing. So I was fortunate to have been able to select it for the Partnership Forum last year, the Commission of Social Development last year, the Humanitarian Affairs segment both last year and this year. And so that was just in June, where I was able to present a 3-minute statement about the current situations in the humanitarian sector after having worked in the field. And a lot of my focus was about international humanitarian law and protection of aid workers, civilians, and critical infrastructures like hospitals, as well as frontline workers and healthcare providers. So you can access all of these statements that we have presented, including the one at the high-level meeting for HIV and AIDS by our colleague Jasper, and the one from Commission for Population Development by Sanele also this year. And so whenever you're speaking, typically there are themes that you can align yourself to. And so, like I said, even when you find that it's not specific relevant to health, there's always an interconnectivity. We've been talking about climate change and how that impacts on health and migration. We've talked about gender equality and how that impacts health. And lastly, a lot of my discussions recently have also been talking about strengthening health systems. Even though I am not a health economist, I did take some classes during my master's degree about health systems. And so now you're able to utilize your platform to speak to ambassadors and speak to ministries of finance when you are addressing the floor to say health is not a burden, it is an investment. We know that 1.62 billion dailies annually are attributed to non-communicable diseases, for example. And so using our evidence-based knowledge and using our platform, even though you think, oh, I'm not a health economist expert, I'm not a water and sanitation expert, but we are experts in witnessing what people undergo and how patients and populations are impacted related to this. Sorry, daily adjusted life years. I should also, we love acronyms. I'm sorry, I also am a victim to this. And so I also wanted to finish off with highlighting some of the events that Sigma has. I'm so happy to see that ARC say that there are familiar faces in the room that have already undertook the academy. And so the International Nursing Research Congress is happening in Toronto next week. And so if you're around, you can still sign up. And we also have 3 major conferences held annually. And so that's Creative Healthy Work Environments, CHUI, that takes place in March. The International Nursing Research Conference takes place annually in a new location every year. And we do have our biennial convention, that happens every 2 years. So please keep in touch with us through our social media. Please sign up to be a Sigma member if you're not already and get engaged as part of a global movement. Such a pleasure. Happy to take questions. And thank you so much for having me.
Thank you, Regina. Amazing insights. And I love that you, not once, but twice, talked about changing our language for partnerships, talking to partners in other sectors. And really, to me, that's being able to use the skills that we have built at the bedside and how we've been clinically trained, but to communicate in the same way, but with different words that really pull in and speak to the values and the priorities of others who we want to engage and enroll into translating that to making sure health is centered in it all. Because if we don't have our health, we don't have a healthy workforce, we don't have economic and social development, you can see how these things start to kind of come back in full circle. But Danny and Megan, I want to pull you back into this conversation too, because I think the partnerships are really something that you've both really focused on a grassroots level, and can speak to that as well. I know, Megan, I've got some slides teed up for you. Danny, if there are some that you wanted to speak to, please go ahead. Otherwise, just go ahead and share now. Like from your position in the Health Collective, what has that meant to you?
Sure. Hi, everybody. My name is Danny Brochu. I am on the board of directors for the Health Collective, and I'm also newly appointed to the Commission for Persons with Disabilities for my town. And I just wanted to talk to you a little bit about the concept of local being global. And I think back to when I was a kid and I thought I was going to save the world overnight. And my mom used to tell me there is nothing wrong with starting in your own backyard, grassroots, focus on what is in front of you. And I thought she was crazy, but she was right after all this time. So I think a lot of what I've learned from being involved in smaller organizations. So the Health Collective is a small nonprofit that's been around since 1984, serving the LGBTQ plus folks within the greater Hartford area of Connecticut. And it has grown to do so much primary care, HIV testing, youth outreach. It's really, really grown over the last 40 plus years. But what I've learned the most from working with such a diverse group of people on our board of directors, I mean, we had a lawyer on our board, we have me as a nurse, we had a construction worker on our board. At one time, we've had some finance folks, like people truly from all walks of life. And And formal and informal community leaders. And what I've learned from them is that diversity of thought is truly what will lend itself to success. Having that real understanding of the community needs is absolutely paramount to being successful. So how does this kind of relate to the big picture of the UN and the SDGs? So partnering between nonprofit organizations and local governments as well are so critical for advancing the SDGs because they combine local resources, expertise, community connections to address these really complex social challenges. Local governments understand the unique needs of their communities and have the authority to implement policies, whereas nonprofits have strong relationships with underserved populations and the flexibility to provide these really innovative grassroots programs. And by working together, these partners can really create more effective and equitable solutions that really strengthen these communities and improve health overall. So that is what I had to say about that. Megan, I know with your work as well up here in Connecticut, I just wanted to pass it on to you.
Yeah, thanks. I'm that whole like local is global as well. But recently, well, it's been 3 years now, so it's not really recently. We got into this idea of like, what do I even do? I'm just a nurse. I say, yeah, obviously we're not just nurses, but like, I didn't really know how to get into this global world. And I reached out to a mentor at the time. She's down at Vanderbilt University. And I said, can you mentor me and help me start meeting new people and really just getting out of my like clinical setting? And what we came up with, and this is, I wanted to share this because this is something anyone can do. And you could do this on any level. And I just wanted to share how we've progressed this project here. We decided to do a global collaborative speaker series. And when you say those words, it sounds super intimidating, or at least I thought it did. What do you mean we're going to talk to people all over the world? How do we get people to agree to this? How do we set this up? How do we advertise this? All those things. And so our first year was this is an example of one of our months. Basically, we just put together a spreadsheet and we reached out to people who were talking about a topic we were interested in. At the time, we wanted people to share, like, what are advanced practice nurses doing in your country? What's the education pathway for them? What's the regulations like? What's the public perception of them? And we just started reaching out to people. I literally was Googling, research papers that had just been published. For example, this is a person I reached out to, Colette Henderson, and I said, hey, I just saw that you published a paper on this. Nice to meet you. Would you consider coming and talking to us about what APNs are doing in Germany? And she was like, oh my gosh, yes. And then she wanted to bring these other 3 folks onto the talk. And so we signed her up for a month and we, got her bio and we did all the things. And then we got someone for another month from another country. And it just ended up coming together beautifully. Something that seemed so intimidating and that initially came together so well. And I think that's because we reached out with kind of a shared purpose. All of these people wanted to share what advanced practice nurses can do in their country. And we just kind of started becoming this little, mind hive of what can we do to help each other advance advanced practice nursing. And then if you'll go to the next slide, we went on and did another one in 2025, but we decided to change our topic. And that's when we really started to get into the partnership, SDG 17. And at the time I was helping at Yale, my mentor was at Vanderbilt, and one of our speakers was a global health nurse from University of Michigan. So we all kind of got on a Zoom call and we said, hey, what if we do the 2025 series on the SDGs and what advanced practice nurses could be doing in terms of SDGs? And so the beauty of that was we started to invite people to the table for planning rather than just inviting them to speak. And that's where it got even more legs on it and really started to spread out. Because, somebody at University of Michigan might know somebody in Brazil. We didn't know anyone in Brazil. Yale invited someone from China. Vanderbilt invited someone from Africa. So it really just started to like spread and spread and spread. And that's where it started to gain, more energy and become even more successful. Then we went into this year. You can go to the next slide. For 2026, we thought, what do we want to do for 2026? And we thought, well, we need to talk about how nurses can work with climate change. And obviously we kept our 3 partners, Yale, Vanderbilt, and Michigan at the time. and went into just finding more people we knew. And so I share it because I think this is something you could do at any level. Hypothetically, if you're interested in refugee help, put together a speaker, just like they've done with our meeting today. Put together a little spreadsheet, reach out to your friends and say, hey, I want to talk about refugee health, or I want to talk about menstrual health and hygiene. Who do you know that would come and talk about this once a month? And, write that down, reach out to them. And it just exploded my network of people. And it really made me more comfortable with global health. And it also made me realize that global health doesn't have to be at the UN. The UN is intimidating, and I don't necessarily want to be sitting in that room with all of those intimidating folks. And I wanted to be hearing what nurses are doing in other countries. And this has just done it. And I just share it, like I said, because I think it's such an easy concept for an intimidating process. I hope I said that understandably, but this is an idea. You're welcome to reach out to me. Like I said, it on paper, it looks intimidating. It looks like we, know all these people all over the world. And really it just started with some emails and a spreadsheet, and it's just grown so well. And we've just met so many incredible people, and it's so inspiring to hear what people are doing down in the trenches and what else you could be doing in your hospital, or again, in your local situation. So that's just all I wanted to share. Thank you. Oh, and you can scan this last QR code. That's the 2026 one. You can scan that QR code. We still have the rest of the year. We have monthly speakers, so you can definitely sign up for all the speakers if you want to hear more about. We're specifically targeting like climate action for nurses this year. So yeah, we're happy to have more people.
I think that is so great, Megan. I love how you just talk about, not that it was easy, because nothing's easy, right? Like, it can be a difficult lift, especially when you go back and forth trying to get people integrated and respond to you sometimes. But when you started to talk about putting some of the, not ownership, but the engagement in the planning part with your partners, I think that's also really helpful to spread the work, but also to expand your access, expand your network, and have just, gosh, this beauty of the partnerships. And that's what's talked about in the UN too, is the meaningful participation and collaboration, not just tokenism, not just making sure there's representation, but is that representation participatory? Mm-hmm. And this is a really beautiful way of a grassroots example of showing that. And really how, you're like, oh, we don't know all these big, fancy people, these names. It's like, no, but I put in the chat earlier, you start to see the same people who are passionate about global health. I don't want to say the same thing because that can encompass so much, but really in the same spaces everywhere you go. When you start to go to these events, you start to go to the conferences, you start to talk to each other in the same circles, you start to be in the same speaking series. We're really just a group of friends, of nurses who want to see positive social impact through advancing health in all policies. And it doesn't matter if you're starting out as a student or your early career, or if you have alphabet soup behind your name and these big titles. We all really want the same things. And I think that's what nurses are also really good about, finding those shared values across so many differences that make our diversification beautiful. I'm going to share a little bit of my story in the spirit of how do you get started? And I will try to make it brief. I can be very lengthy. This is why I speak to scripts when I'm presenting formally, because I'll just keep rambling. But how I went from zero to today. I have always been interested in international work, and I have had the privilege of being educated across 4 different continents. I studied abroad in 3 of my degrees. I went to Europe, and I learned the European Union in my business degree. I was able to conduct my public health rotation clinicals in Brazil. And I'm on the call here with one of my amazing colleagues, Roger. We are both at the University of Global Health Equity together, which is based in Rwanda and is doing obviously a lot of global work speaking to its name. After I graduated nursing school, I wanted to stay connected to the international community and start doing clinical work. So after I got a year's worth of experience at the bedside, I started to volunteer for an organization called Project Cure. the bread and butter of their organization is medical supply donations, and they ship medical donations anywhere from gloves to ultrasound machines, anything you can think of all around the world. And as part of what they do is following some of those container shipments of supplies in countries where they've been asked, and they have a lot of support with a local partner and the Ministry of Health. They bring in clinic teams to do some health fairs, free health fairs. And their focus is posts outside of the formal clinic posts in rural areas to increase adoption and utilization of the local health system by referrals. So I did that. I did that across about 10 different countries in South America, Africa, India, for about 5 years until COVID literally grounded us. I got the last flight out of Cote d'Ivoire in March 12th of 2020. I will never forget that 2 a.m. wake-up call. And that threw me into COVID ICUs, where I was an ICU nurse in the States, traveling around the country for about 4 years. And through all of that, I loved my direct clinical care delivery experience. And I had, maximized my specialty. I felt like within my specialties at the top of my game. I didn't have a lot of upward movement unless I wanted to get through management. But I didn't want to stick with one health system. And I didn't want to climb the clinical ladder to be a CNO of a hospital one day. That's great for, people who that's the track and path they want to take. But I saw more of the systems level. I saw the policies that affect the systems and why that was the red tape and the barrier for me being able to implement care in the way I knew was necessary and just as good, because I'd had so many different experiences across 12 different health systems in 10 different countries. I can see more than one way to do something well. And I wanted to address the systems level policy in the way that I could just go in and press that button on the IV pump and change the LevaFed and see my patient's blood pressure go up or down. Well, up if it's LevaFed. But I wanted to get involved in more advocacy and I wanted to show my leadership capacity, because I never had that title. I didn't go into management. But I had a lot of years of experience leading teams, and it wasn't just the care delivery. It was the pre-trip planning. It was the cultural humility training. It was the budgeting. It was the coordination with the partners on the ground. It was scheduling flights by WhatsApp while I was trying to get people out of a country so they could go home. Those are some skills that all nurses have and may not realize it. The care coordination at the bedside of getting multiple specialties and teams together and making sure that they focus on what the priority is for the patient, not from their specialty, but from a patient-centered and a holistic view of what's going on with their care and why they're in your room in front of you right now. Those are some what's considered soft skills, but I think they're power skills to be able to bring people together across differences. It could be political differences, it could be specialty differences, it could be language differences if you have an international patient. And the way that we communicate that is an evidence-based backed way. Okay, we have our SBAR format, our situation, background, assessment, and recommendation. And if you think about it, there is not always access for every one of us in the room at the UN. But hallway diplomacy is really where the work happens. It's the people on the ground with the insights connecting in a educated, evidence-backed, diplomatic way to get our priority across, but also to make sure that it is in collaboration with everyone else's priority. And so if I had just enough experience getting started in the UN ecosystem that I could see an ambassador in the side of the hallway and say, hey, I actually just listened to you speak on this topic about this location and this population. I have some insights for you. Here's my SBAR. You can use that exact same framework that we're all very comfortable with to engage across sectors and across to some people that we consider intimidating, right? And so that was how I just got started. I didn't have a specific way or an entree. I did the exact same thing that we talked about here today. I went to CSW. I self-funded Shazia. I showed up and I maybe didn't know everything that I was doing, but I knew that if I was immersed in that environment, I would start to learn the way. And I did the same thing at the Goals Week along the sidelines of the UN General Assembly in September. And I started to realize not just the people that showed up or the organizations that started putting on the events. I started to learn more about okay, I care about this, but what is everyone else in the room talking about? I started to show up only to events that had health or nursing or something that I thought it was more relevant in the title. But then I started to go to other events. I went to financing events and economic events. I went to anything that you can think of because health is centered in all the SDGs, and we know that. And I had much more opportunity to bring a fresh perspective and ground level insights when I was in a room where I would not have felt by the title necessarily comfortable. But another thing I want to talk about is the space that we provide in this cafe and community. We start to talk about how to just get started. And part of that is you have to learn about what's out there, but you have to know what your why is. If you center on your why, you start to read about it, write about it, speak about it, you become a subject matter expert so that when you are immersed in the environment and you have that moment, that 2 minutes or less of hallway diplomacy, you've got your SBAR ready because you know what that topic needs, just like you know what your patient needs. And I want to say that in a way that makes it really approachable for anyone in this room, anyone who listens to the recording later on, that it doesn't matter how much experience you have, if you are just driven enough and motivated enough to pay attention and make yourself the subject matter expert and reach out to those who think that you think know more than you or are experts on it and become that expert yourself, you can also do this. And what I'm going to talk here today as well is about SONCL, because as I started to look for the less formal in terms of not a paid title, but leadership capacity in grassroots advocacy organizations, one of them has been through SONCL, which I'm so proud of because the way that they approach what they do in their advocacy in an innovative way, it lends itself as a space where you can start to think differently and you are appreciated for going against the grain sometimes because we all have amazing ideas and sometimes innovation is not a new technological development tool. Sometimes it's innovation of idea and thought and policy change to be able to deliver care around the world in the way that we know matters. One thing that I am so lucky and privileged to do is to be on the board of directors of SONCL and chair the United Nations Committee. And what I just spoke to you about, not only my individual story, but what I really care about, what I value about getting early and open access to students and early career nurses and diverse insights, even just across nursing, is to be able to pull it all together in a way that immerses us in the United Nations space and builds the capacity to do just what I was saying. And this was not built by me. This was built in an iterative way over many years across several amazing colleagues. But what it has grown to now is to be a hybrid event, the SONCL United Nations Immersion Program for Nurses that brings nurses to New York, that immerses them in the United Nations headquarters, not at specific high-level events, but through at least a tour to understand, okay, what does the United Nations stand for? What does it look like inside of the headquarters? How can I overlap the human rights components of their charter with our code of ethics as nurses to really show that overlap and alignment of why nurses belong in this space? We have curated briefings from different agency representatives so we can hear from the UNDP or OCHA, all these different people who are not health professionals necessarily, but working in spaces that intersect with health, and to really see how our insights align with the priorities of each one of those agencies. We talk about the different pathways like Arik just beautifully explained. We talk about the different skills that you need to develop to do that. And we also have integrated an innovation sprint, not a full-on hackathon, but a way to do a quick deep dive into innovative thought. How do we approach healthcare differently in this environment, in this space, by making sure it's human-centered, that we are leading with empathy, and that we can emerge to a new UN 2.0 structure alongside UN 80 in the future of what the United Nations is going to be. It includes things like the citizen diplomacy, hallway diplomacy, and science diplomacy. We talked about the cultural humility that it takes to engage with others that are from diverse perspectives, others around the world, and really strengthening that idea of health inserted and centered in all other policies as it relates to centering health and SDG 3 to all the other SDGs. I am so happy to talk about this in more detail with anyone who's interested. This is multiple years ongoing now. We are going to be in New York again, October 14th through 16th, as well as hybrid. I know I have some participants, past participants of the UN Immersion Program on the call. If you'd like to speak about your experience participating in it and what your takeaways were, would absolutely love that. We do also want to invite everyone back because we try to make it a little bit fresh and new because we do have returning participants. And I think that even though you might have some foundations of the UN itself and how nurses belong in that space, the way that we engage in the sessions that we create, the speakers that we have are different every year so that there's still fresh new takeaways. I learned something from this session today already. It's lifelong learning that we have. Angelique, it's really good to see you. I know that you have a lot more to say. We'll take a small transition now, not just to specifically the UN space, but also talking about international conferences in general. So I think what you're about to share and the preparation that we can all have for international conferences relates as much so to the UN parallel and side events as it does international nursing conferences and other conferences.
For sure. Thanks. And so my name is Angelique Conflenti. I'm a registered nurse, been a nurse for about 10 years now. And I'm the program coordinator out here in New York City for our health screening van. And thanks, sorry. For our health screening van as part of our lung cancer screening program at Weill Cornell Medicine. So like Grace was saying, really, these international conference experiences have huge potential to really change the game when it comes to your nursing career. But they can often feel very overwhelming. So when you're first starting out going to these, it can be really intimidating. You might feel some imposter syndrome, not feeling like you belong in that space. But hopefully, some of the conversations we've had today and some of the tips and tricks I'll give you here will help you feel more comfortable about the idea, empowered to really, have a voice in that conversation. And this can also be applied to more local conferences too. It's not always just the big international ones. They're not always accessible to everybody. But yeah, I think really want to emphasize that you do belong in those spaces. You don't have to be an expert or researcher or an executive to go to ICN Congress or a Sigma conference or something like that. Even going as a student is such an enriching experience to just see what people are doing, get that early exposure, and then to have that kind of influence your moves down the line as far as your career goes. So highly encourage students to go as well. And really just that genuine curiosity to learn and an open mind are the only two requirements. You get about as much out of it as you put in. So everything I'm about to say, I go hard when it comes to conferences. So I put a lot in. This is not, the expectation for a normal person. It's something that I genuinely enjoy and I've gotten hooked. So, take it with a grain of salt. But yeah, I'll jump in now to that slide, Grace. I have my speaker notes on the left side of my screen. So hopefully I don't mess up with your slide sharing here. But yeah, so I'll just talk briefly about, just touch on my first international conference experience, some tips and tricks for getting yourself set up for success prior to going to the conference. A little bit about LinkedIn and how that really is like your digital business card when it comes to these conferences and your digital footprint, strategic networking and authentic connections, and then taking that next step of submitting an abstract and participating in a conference in that way as well. Let's go to the next one. So as I mentioned, I often refer to ICN Congress as my Super Bowl because it really does feel like the thing I've been waiting for, all year, every 2 years now. But that was my first international nursing conference back in 2023 in Montreal, Canada. I was actually living in Scotland at the time and getting my master's in advanced nursing at the University of Edinburgh. And my professor, Aisha Holloway, she's taught my nursing global health politics, developing your political leadership course. It's a very true NPEC essence there. She was really the first mentor that really changed my perspective on the true scope of nursing on a global scale. I have had some international medical service trip experience in Ecuador and Guatemala as a nurse and as a nursing student, but this really changed the game for me as far as imagining what nurses can do in those policy spaces, and really, kind of that planted the seed for that identifying as a nurse advocate, and was really instrumental in kind of kickstarting my journey since then. But myself and two of my friends from our program, we decided to we couldn't get it out of our heads that we wanted to go to this conference on the other side of the ocean. And so she planted the seed, but we made it a reality. Oftentimes students might be eligible for a discounted conference registration rate or any type of funding from the university. I think you might have touched on this, Ark, but if you're going through your workplace or you're presenting, they might offer some sort of stipend or coverage for these conferences. That was not available to me. So we self-funded, but it was fine. And very, very happy we could go. And yeah, like I said, I knew I was hooked from then. So just some highlights from that in a first experience in a nutshell. We did the pre-conference student assembly with ICN, which is the day before the actual full conference kicked off. And that's just a really great way to meet some folks before jumping in and network and see what other people and nursing students were doing around the world. And then also my hot button issue is climate change and planetary health. And at this conference, they had their first planetary health symposium at an ICN Congress, and I actually cried. It was beautiful, and I got to meet all of my planetary health nurse icons, as we can see here, and it was just really lovely. So, looking forward to going to ICN Congress next year, and attending that planetary health symposium, but. Policy cafes, that was probably my first introduction to the idea before NPEC had ever crossed my desk. But yeah, really lovely experience. Okay, so setting yourself for success. So the know before you go. There are things that we can do in advance. Again, if you have the time, this is not always required, but it will help make your conference experience a bit smoother and a bit more streamlined. And really, again, to get the most out of it, of what you actually want from this experience. So the first step, obviously, is researching the conference, making sure that it aligns with your personal and professional goals, reviewing that theme, the objectives, scientific program, and really identifying those key global issues and topics being discussed. And this will vary depending on the conference. It's different from ICN Congress to ICN Congress, but especially if it's more local, organization that's running the conference, then this might be hyper specific to your local context. And I know we previously, I think Danny and Megan were talking about that local to global kind of perspective as well. So again, a lot of this is applicable to other contexts. Researching those keynote speakers, presenters, and organizations as well. And that could be the plenaries, the poster sessions that are going to be there, and just kind of getting an idea of what's on offer, I guess. A lot of times, when you're building out that personalized agenda, then you want to make sure you have a couple prioritized must-attend sessions, like that planetary health symposium. I know I'm going to go prioritize that over anything else. And so a lot of times these really bigger sessions tend to fill up really quickly. So definitely arrive early, make sure you get a seat, you can network beforehand and talk with folks. But really just have some priorities going in, just so you're not disappointed, and you have a plan and a backup plan as well if you're not able to attend ones that you want to. The way these conferences work, there's usually a lot of concurrent sessions. So there might be 5 sessions you want to go to all at once, but you physically do not have a time turner like in Harry Potter to go to every session. Can you imagine? Oh my gosh. Sorry, I'm distracting myself. But you cannot do that. So that's why the prep beforehand is helpful. And like I said, you can download that conference app and see the agenda breakdown. They usually have that within a couple months of the conference itself, pre and post conference events. So with ICN Congress in 2025 last year in Helsinki, Finland, then Sansiel did a hackathon beforehand. It was the day before. And, that was a really wonderful experience that we were able to participate in because we had pre-registered for it. It was something that we, prepared for. And then also post-conference events as well. I know, I think when Helsinki and in Montreal, then ICN offered like tours of different healthcare facilities throughout, different areas of the country so that you can understand that context a little bit more. Does someone have a question or just checking? I don't know who's unmuted. But yeah, so just taking a look and really seeing if there are any other opportunities you can add on to your experience, because you're going all the way, outside of your country, going international. So really, again, taking advantage of the full experience will only help. And also, I think highlighting the idea of really leaving room for spontaneity. So of course you can plan it down to the minute if you want to, but as I'm sure we touched on somewhere in this session today, really some of those memorable experiences happen in between the sessions, in the hallways, and in line for coffee, during those poster discussions, where it's more casual and you can really kind of break down some of those barriers and have those authentic connections, and really be curious about someone's work or what they're doing at the conference. So really being open to those experiences is key as well. And I put here, important to adjust your expectations. I learned this the hard way. So conferences are very exciting, right? There's adrenaline. If you go to ICN Congress, it's like a concert sometimes with Howard Catton over there waving everyone's hands and the flashy lights. So it can be very exciting, but it's also physically and mentally very demanding. Some of these conferences are, multiple days in a row. And so just being really aware of your capacity, scheduling breaks, staying hydrated, all that stuff, wearing comfortable shoes, packing the pair of sneakers, because you will be wearing that by the end of the week. You'll start off in heels and then go to the sneakers. Weather appropriate clothing, all that stuff. This is general advice, but we're all adults. We can think to do that in advance, but genuinely pack comfortable shoes. And then just, as far as that international travel aspect of it goes, my advice would be to try to arrive a day or two early to recover and just prepare for the time ahead. When we went to Helsinki last year, then I went to Finland 2 days beforehand because I knew I'd want some time just to recoup. And I actually went on a guided hike in the forest, in the Finnish forest beforehand. And really that tied in with my love of nature and experiencing different environments and everything when I travel. So definitely recommend those types of experiences, and really understanding that, again, it's a marathon, not a sprint. So I will move on to the next slide. Some quick photos here. I see some familiar faces. So yeah, on the left, there's me on a log in the middle of the Finnish forest because I needed that. And Megan and I went to a sauna on the Baltic Sea in Helsinki as well, the day after the conference ended to recover. And, just seeing some sightseeing before and after, the conference every day, making sure you're really getting the most out of that experience. I was walking around Helsinki at 11 p.m. at night and it was still light outside. And I was just like, I went to a cafe and had a cup of tea and a piece of cake and listened to, music in my headphones and just drunk it all in. So very important. And then also you get to explore local fare, some canned bear in the Finnish, supermarket. So if you want that, that's there. But I wouldn't have known that if I didn't make time for spontaneity. So emphasizing that, but yeah, some pics from the hackathon, some of our NPEC members there as well. And thought those are some fun photos too. Let's pop on over to LinkedIn. So as I said, it's kind of like your business card. Some people do have the physical business cards. I think in some situations it's nice to have that, physical item. But a lot of times it's more planet friendly if you just have that on your phone. They do have apps that you can, upload a business card type of profile and have people scan a QR code. But LinkedIn is obviously a network of either nurses or other types of professionals that you could collaborate with. That's much more expansive. So highly recommend, if you're not on LinkedIn, to definitely kind of hone that online presence. I hate to use the word professional brand, but to really have it gives an indication of what your professional goals, values, experiences are, and can show someone, who you just met, that this is what you kind of stand for, and this is what you're trying to do in your kind of section of the world here. But yeah, it just reinforces those conversations that you've had, and helps connections remember you and then stay in touch long before the conference ends. Yeah. So with LinkedIn, that's a whole nother beast as far as how to really update that profile before the conference to reflect just kind of what you stand for with your nursing career and everything. But it really plays a part in that strategic networking, which is kind of a cringy phrase. The word networking, especially for nurses, is not a natural skill that we don't think we have. But oftentimes, when you're at the bedside, you're having different conversations with different people from different walks of life, different professionals in different settings. You kind of find that once you get going, it can be quite easy, and especially if you tie that to that authentic connection with folks, is really when I really reframe it, and it's much more rewarding. And I want to do it. But there are things to do before, during, and after the conference to really speak to that. I already highlighted some of these as far as getting that app for a conference. A lot of times they have a community or a chat feature on there. You can look up different people's posters and then put that on your agenda. Make sure you have that name on your list of people you want to connect with. Message them on LinkedIn beforehand. Starting to sound like a stalker, but you can do that. You can do that, and people appreciate it, and they like to be recognized for their work. They like meeting people who are interested in it. People have done that with me. I've done that with other folks. And I think especially within the global nursing community, people are very open and want to have those discussions with other nurses. And like we're doing today, kind of spread that wisdom throughout the workforce. So highly encourage you guys to do that. Organizing your own meetup. I just, and then we don't have to go there just yet, but in the next slide, put some photos of our NPEC meetup that we did in Helsinki. Already, had to do that planning and prep beforehand as far as making reservations and organizing dates and times, but really, really rewarding, because a lot of times you're seeing people that you know from LinkedIn or from other conferences for the first time in years, because they're on the other side of the country, other side of the world. So intentionality there is helpful as well. During, obviously, like I said, that mindset shift, sitting with someone new, don't always stick with the people that you went to the conference with or that you know from work, because you really got to get out of your comfort zone and talk to people and learn more and be curious about what other nurses from around the world bring into that conversation. Someone doing lung screening in New York City is very different from someone doing lung screening on their side of the world, or any other topic. So highly encourage you to branch out. And yeah, visiting those poster presentations, and also talking to those presenters. If there's a really stimulating session that you went to and you're geeking out over it, you can internalize that, but I would highly encourage you to actually engage with them before, during or after. Ask a question. And when you ask a question, stand up, physically stand up, state your name, your title, be confident, and then approach them afterwards and make that connection solid. Just that alone is, 90% more of the effort than a lot of people, tend to make at some of these conferences, and sets you apart from maybe some of the other colleagues there. So, really encourage you guys to do that. And then the exhibit hall is wonderful too, has a bunch of different vendors and relationships that can be fostered there as well. Afterwards, kind of self-explanatory, but obviously following up in other ways, email, video chats, coffee, talks, whatever, to really solidify those connections. All right, we'll go to the next slide. Actually, back to the photos, please. And I just want to point out like 2 examples here, because this is the networking in action and the authentic connections from Helsinki, really. It's kind of crazy, the transition from that first day, the last day of the conference, because then the first day, the people you came with. The last day, you're seeing people in the hallway, you're recognizing people on a first name basis, you're seeing people interact, and you have this, even in that 4-day period, that network has expanded significantly. I all around Helsinki, I was recognizing nurses that were at the conference, such as Dr. Beverly Malone. We saw her on the train station, and I was like, oh, she gave a plenary this morning, and she talked about X, Y, and Z. And I told Megan, I'm gonna go approach her, tap her on the shoulder as we're walking, back to city center for the day, and just say that I appreciated what she talked about. I made a personal connection. She's from Kentucky. I lived in Kentucky for a little bit. My family's out there. And that's really all you have to do. But it's really rewarding experience to have those authentic connections. Same thing for the photos on the right. We were watching a plenary speaker, and it was about I believe it was about technology and informatics and things. And 10 minutes later, I went to the exhibition hall, and the speaker is there at their booth talking to folks and different nursing students and engaging. So having that immediate opportunity to put those skills to the test was great. And yeah, just some photos of some of my Canadian friends there as well. I love you, Canada. On a river cruise as well. But always be open to those connections. All right, next one, please. So yeah, you guys started to jump into this. I don't have anything super specific as far as that abstract process here. I think that could be its own presentation of itself, and we've already been talking for 2 hours. So there's more information online, but again, just encouraging you that you don't have to be a researcher or an academic to present at a conference. There a lot of different perspectives are needed. It could be a QI initiative, community health, education, but take a look at those conference themes, those sub-themes and everything, and see if there's something where you can fit in. Those call for abstracts, I think I heard Grace talking, usually go out a couple months beforehand. And you don't have to have, a fully fledged proposal or something to submit. It's generally a brief summary and some of those just, line items to check off. I'll go to the next one. Personally, I submitted an e-poster for Helsinki. So in ICN 2023 was my first time there, and as a student, drinking it all in. When I left, I told myself the next time I go to ICN Congress, I'm going to present. This was, 2 years before the fact. In those 2 years, then I finished my master's degree. I completed my master's dissertation about nursing, early career nurses' attitudes towards climate change, completed that dissertation. Then all I did was turn that literature review for that dissertation into a poster, and it was accepted. I didn't even publish that literature review. It was methodical and it was something that was rigorous, but it was just putting that new knowledge out there and seeing there was a demand for that as far as the conference themes go, and it was accepted. So that was a really fantastic experience, and it's really with e-posters often a lot less intimidating than oral presentations, more low key, allowing for those one-to-one conversations and helping build up your confidence. And like I said before, kind of touched on, some of those most meaningful connections happen even just during these more informal times at the conference. As you can see in those photos, we have some very familiar faces, many of whom are on this meeting today. In the photos are NPEC presenters and our own e-posters. Also, we have Lamek here and his crew. That was one of the on the last day, I think. But we all did kind of like a round robin of all our e-posters and listened to everyone's and commented and had really stimulating conversations. So hearing about new initiatives from around the world in these types of environments is really, really cool. Okay, and yeah, I'll leave. We'll send out the slides. We'll leave this here, but this is just specific to ICN Congress 2027 in Taipei. Hope to see all of you there. But the call for abstracts has gone out, where they've announced like the sub themes and everything, but they have specific deadlines for when you can actually submit these abstracts, and you can only submit one for these different types of presentations here. So oral presentation, that lunchtime spotlight, and the e-poster. So just, really think what format you think your content would be best presented in and what you feel comfortable with, and go from there. And usually it's great if you can have like a colleague or mentor take a look at your abstract just to kind of give it a once over before submitting it and get a fresh pair of eyes. But they have a lot more information on the website as far as their specific guidelines. Okay, last slide here. Thanks for sticking with me, guys. Key takeaways. So, what I'm hoping you're getting out of this is that preparation creates opportunity. The work that we do before the conferences, researching those sessions, setting your goals, refining that LinkedIn profile will really allow you to arrive with confidence and make those intentional decisions rather than simply reacting, to the schedule and it happening to you. You want to be very intentional with how you go about it. You don't have to do everything for it to be a successful conference. Like I said, it's a lot of adrenaline, it's a lot of excitement. There's so many cool things to learn and people to meet. But also give yourself some grace that it is impossible to attend every session and meet every person. But really staying flexible and leaving room for the unexpected is key. Relationships are the greatest return on your investment. So, the sessions will end and everything, but really the relationships are the things that really sustain in the long term, like we're doing today. And that could be in person or virtually, but really, just like leaning in with curiosity, asking thoughtful questions, and remembering those connections that are built through those genuine conversations. And that consistent follow-up is really, really key as well. Your professional story is still being written. So this is something, every conference you go to, you meet new people. It changes how you see the world and your work and your voice in that space. And it's a story that's keep on writing it. Everyone you go to, and sharing your story intentionally so others can not only understand what you do, but also what you're passionate about and how you're hoping to make an impact in the future. Very last one, which I think we've all been talking about today, is that our voices as nurses, whether that be early career, mid-career, later career, retired, whatever, all of our voices are important and belong in these global conversations. Whether it be that, talking about a quality improvement project or a community initiative or a research study, those experiences have the potential to help others who are navigating something similar in their clinical setting or in their career. And we really I don't want you to wait until you feel like an expert to submit an abstract and really share your voice with the global nursing community. And yeah, every nurse brings a unique perspective, and our profession is stronger when more voices contribute to that conversation. So thank you guys for sticking in to the conversation and letting me share our experiences.
That ICN also has the APN conference as well. So ICN, the Super Bowl ICN, as Angelique said, that's every 2 years. And then on the alternating years, there's an ICN APN NP network conference. It's a lot of initials. But I know some folks who are not nurse practitioners in the United States thought, oh, well, I shouldn't go to that because I'm not a nurse practitioner. Well, nurse practitioner is a very US-centric role. It is expanding into other countries, but really it's about anything advanced practice. So if you're a nurse in another country who has gone on and had some extra training in cardiology, for example, and you're recognizing malaria, heart arrhythmias, out in the community, you're an advanced practice nurse in all reality. So you do not need to be someone who can prescribe medication. You don't need to be at that level of practice to be coming to the ICN APN conference. It is a much smaller conference. There's only about 2,000 participants. So it is a little more of an intimate setting. You're going to meet a lot more colleagues, I think. It's a fantastic conference. It is going to be this year in September, so it's coming up soon, and it is in Nashville, Tennessee. It's come back to the United States after many years. It was in Scotland 2 years ago. But I just wanted to throw that out there, that there is a little bit of a subset of ICN if you want to dip your foot in the water that way as well.
Absolutely.
Can I mention something really quickly about being a youth representative and being a student, and as far as funding goes as well?
Yes, please.
Sorry, can you guys hear me? Yeah, thank you. So I, as Angelique said, you outlined so many wonderful resources. And so something that I constantly do, even on LinkedIn or there may be other pages, is look for youth opportunities. Pardon me. I believe one of them is youthopportunities.org. Or a lot of these associate websites that kind of highlight opportunities that even goes to education. So, when it comes to scholarships about specific conferences, there's youth specific conferences, and you can be the health voice in that. And so please, when you're bringing such an intersectional lens, even when the conferences are not specifically in health, I would highly recommend signing up for those kind of websites so you know the the outline, or sorry, I guess the world in which we can be represented in. I feel like there was a lot of discussions about self-funding, and I think when you're working within the nursing sector, the public health sector, the global health sector, there is a lot of self-funding for us to continuously grow and get new education opportunities. And so I would say that one tip that I always have, especially when you go to a lot of these high cost of living cities, like in New York or in Geneva, is when you have a lot of side events that are something that you want to go to, prioritize the ones with food. And so when you go to these side events, like Angelique said, I wish there was a time turner. I wish I could attend. There's so many interesting things. But the reality is, you're in New York, you're in Geneva, or you're in another conference that may be taking place in another country. It is expensive. And so please, when there's two conflicting ones and there was one that offer breakfast, I always pick the ones that offer breakfast, because this is the reality, is that you're doing a lot, and you also have to take bus tickets and train tickets in between places, and sometimes those are not free either. And so when you have those opportunities, please utilize them. And then last one is that when we're talking a little bit about the conferences and the side events and a lot of these mixers, and so even when there are plenaries and there are ones that I really, really enjoy, I'll do research beforehand, and that's my bread and butter, for example, like in the humanitarian sector. But when there's side events, I actually prefer to engage in those much more, because you're in a smaller, intimate setting where you can typically go and approach. All of us that have been to large conferences and meetings knows that as soon as the meeting is over, obviously a lot of these ambassadors, the people that are really important that you want to be able to speak with and network with, will be whisked away immediately, because they're very busy people, maybe even in the middle of the session. And so when you attend these side events, typically you're in a much smaller setting where donors, stakeholders, ambassadors, and panelists will be able there, and they'll be able to actively engage with you afterwards. And that's when you can make that quick network moment, exchange your card. And a lot of us beyond LinkedIn, now I also have a e-card. And so that's a QR code that you can scan immediately. So a lot of these places are come and go really, really fast. And so immediately you can scan your QR code, and then you can both move on, because that's where the conversations really take place. And that's how partnerships like this were able to continue as well. So thank you so much.